Hello.
Hello, Andrew.
What's going on?
Not much. Did you notice actually if Sunny ate any cookies?
I don't believe she did. She's up here right now.
She is now, but there was a time when apparently you went outside and I was up here.
She was up here.
She was not.
Well, I didn't see any signs of a dog theft.
Because she ate all of our ginger snaps last year.
Well, she's got a taste for them. I don't believe any were stolen.
Okay. We'll see.
Everything looked too orderly for her to have gone in and eaten a tray of them.
Okay. I did put some of them in a container, but
I saw that.
I left some of them out. Have you tried them?
Yeah, I had one. They're good.
Very good. You're not supposed to try them.
No. You can't say, did you try them? And I go, yeah, they're really good. And then you're like, oh, no. No, I knew I could have one. So I had one and I moseyed on.
How did you know you had?
Because you were chirping about the snowball cookies yesterday, and I figured one's the limit. But I don't like snowball cookies that much.
Really?
Yeah, no, I've said this every year. They're not my favorite.
Snowball cookies are so good.
No, you like them because they're boring. They're the most boring cookie you make.
No.
They're 100% the most boring cookie you make.
They are not. They're minty and salty.
We have this conversation every year, and that's your defense. They're minty and salty.
They're good. Okay, well, what? Okay, you don't really?
Yeah.
You used to really like them. Okay, so what's your favorite Christmas thing then? Baking that I do? The Ritz ones?
Probably.
Are those my score ones? I can never remember.
No, not the score ones.
Yeah,
maybe the score ones. Yeah, with the little icing on top. Yeah.
What's your favorite? Is that your favorite?
That's probably my favorite.
Okay.
Overall favorite cookie? Shortbread.
My mom's Earl Grey ones?
Those are very good, yes.
Or just plain?
If I was to be asked what's your favorite cookie, it'd be shortbread. Doesn't matter if it's got tea in it or not.
What about my caramel shortbread thing that I make?
Yeah, all right. I don't need the extra bit. Shortbread's fantastic on its own.
Cool beans. Alrighty. Should we get on with it?
Yeah, 100%.
Okay. Well, today I'm very excited. I have a guest.
I know. I'm right here.
Not you. We're going to Zoom somebody in.
Sweet. Who we zooming?
Paige.
Well.
Let me tell you about her.
Please do.
Okay, I'm going to be official, so no joking around. Paige Rome, she's a recent Master's of Counseling Psychology graduate student. She's working towards her registration as a psychologist with a focus in sleep psychology and perinatal mental health. Paige is certified in CBT-I, and she hopes to explore its potential as a preventative treatment option for those at high risk for the development of insomnia, including perinatal women. Paige is also a mom to 4 boys herself, the youngest, if you can believe it or not. I can't believe she's here with us today. He's only 6 weeks old, so she knows a thing or two herself about sleep deprivation. I can't believe she's got 4 boys. I always wanted 6, but talked Annie down to 4, and then I had 2, and then I was done. Well, thank you so much, Paige, for joining us today. I am very excited to have you on the show with us.
Yeah, thanks for having me. I'm excited to be here as well.
And we're talking about how to help support new moms, and you're a new mom yourself.
I am. I'm a brand new mom. I've got a 6-week, almost 7-week-old downstairs right now, and a 2.5-year-old in the next room taking a nap. So, yeah, mom all around.
How is that balancing the two?
It's tiring, I will say. I was thinking that the 1 to 2 transition would be easier than the 0 to 1, but I'm finding it a lot more challenging so far.
Oh, tell us.
Oh, my 2.5-year-old is having some struggles with it. You guys probably know all about that with 2. He thankfully isn't taking it out on the newborn. He's actually quite sweet with him. Like, he'll bring him little toys and stuff. It's pretty adorable, but he's definitely taking it out on his dad and I.
Okay.
Yeah, we're getting a lot of the "I don't like you, mommy."
Yeah.
"I don't like you, daddy," which, just hurts the heart, but he is getting a lot better now. I think he's starting to adjust. So that's good.
It's hard. Well, we had a 4-year-old when we had our second.
Yeah.
And I had to put her on our behavior plan because, 2 things. Really, the big thing, the behavior plan was just touching the baby's head. I'm like, just stop. And she'd smother her, loving and kissing. And she loved the soft spot. And she oh, why can't I touch that? Ooh, now I need to touch it. And she was just full of love, but just smothery.
Mhm.
But she was more attention seeking, I'd
Oh,
say
yeah.
too. And then in every picture, it's like, dude, get out of the picture. Like, I just want to take a video of your sister for a second, right? But then she's like, oh, but what about me? And there's just a toe or a finger or just something in every picture.
Which is
Yeah.
funny because she was
Excessive.
just chiding us the fact that there's not pictures of just Willow. And I'm like, well, yeah, you were in 90% of them. That's why there's not as many of just her.
She would always jump in, try to mother. So
Yeah.
I kind of jumped ahead here. Normally
It's
I
okay.
have our guests tell us a little bit about themselves. So besides being a new mom, what else would you like to share?
Yeah. Well, right now that's the most relevant part of my life. It's kind of all consuming, but I'm also a student or recently graduated student, which is very exciting for me to have finished my master's in counseling psychology. So I will be taking this next year off just to kind of hang with the babies at home. And then I'll be looking to do my registration in Calgary. And my hope is to kind of specialize in sleep psychology. So that's been a really interesting, the meeting between being a mom who's not sleeping at all and, knowing quite a bit at this point about sleep psychology and, what's actually going on with me when I'm not sleeping.
Yeah.
Mm-hmm.
Well,
Yeah.
that's a perfect segue, I guess, into part of why I wanted to bring you on. You had done some research just around the sleep and newborn moms, and so thought it would be really helpful to kind of chat about that. So why don't you jump into some of the things that you researched and what would be helpful for new moms to know?
Yeah, for sure. Just cut me off if I ramble because I tend to do that. And I am really passionate about this subject actually, so I can kind of talk your ear off. So just pause me if you need to jump in.
All good. All good. And Andy will jump in too.
Yes, the floating voice will pop in. Can't actually see him right now.
No.
But yeah, so I mean, when you talk about postpartum sleep, what kind of comes to mind is that you don't get any of it, right? And that's kind of to be expected, or it's kind of built in. There's this expectation that once you have a baby, you're just not going to sleep anymore, and that kind of comes from I think a large piece of it is cultural. Like you hear that from parents and grandparents. Oh, get all the sleep you can before the baby's here because you're never going to sleep again, and it's kind of said as like a joke. But it's, fairly accurate. You can, end up sleeping very little with a new baby. And that part of it is normal, or most of the time is normal, but sometimes it's not. And sometimes you can actually cross it, like from a typical amount of sleep deprivation into perinatal insomnia disorder. And that is what my manuscript was on. And it's oftentimes tricky for a new mom to tell, like, is my sleep normal? Or is it not, just because of that expectation? And, if I go to the doctor about this, are they going to laugh at me and just say, I'm a new mom and send me home? Or are they going to take me seriously? So it's often really hard to determine if you need help and to get the help that you need when you're a new mom who is actually having difficulties with sleep that aren't in the normal range.
So
Right.
what would, for someone like me that doesn't know what the ranges are,
Mm-hmm.
what would you define normal versus abnormal before you would start needing to look for indicators that there's something wrong?
Right. So in order to be actually diagnosed with insomnia disorder, there is a criteria that you need to have adequate opportunity for sleep. So the key here is if you're a new mom whose baby is waking you up every hour on the hour, that's really hard, but you're only awake because your baby is awake and needs you. So if you find your baby's sleeping longer stretches in the night, but you are not, you're still awake and you are having trouble sleeping, even if you have adequate time and possibility to sleep, but you are still not able to fall asleep or stay asleep, and it's affecting your functioning in the day.
Okay.
That would be how you would kind of determine, okay, no, this isn't actually normal and I should maybe see somebody about this.
Mm-hmm. And you're right about the expectations. I even remember I had to stay at the hospital for a couple of nights after my first daughter was born, and she was sleeping like her first day alive 4 or 5 hours, and I got scolded, and the nurses are like, you cannot sleep, you are not allowed to sleep for this year, and you got to get up and wake up and be with her and make sure she's feeding. And I've always had the mentality, like, if they're sleeping, let them keep sleeping. But obviously, I guess newborns eating regularly at the beginning is important, but yeah, like, that's the message that they instill, right? You just don't let them sleep. And you can't sleep.
No. Yeah. My son slept 6 hours the other night for the first time. And instead of enjoying it, I was up Googling, like, is this okay? Should I wake him up? Like, yeah, it's hard to take advantage of the times when they come, because you've heard so much about how you're not supposed to.
Well, that's funny, because remember the first time, I think we've shared this story before on the podcast, but with the first time my first daughter slept through the night, or it was probably about 6-7 hours, I'd say, my husband's like, she's dead. It's 3:00. She hasn't woke up. She's dead.
She was dead. It was that abnormal feeling of something's not right. Why isn't she awake? Like, she should be awake by now, right? And
so he woke me up, and I'm like, dude, if she's dead, she's not going to be any deader in the morning. So we may as well keep sleeping and get a good night's rest to be able to handle it. So I went back to sleep. He did not.
No, I went and checked on her. And then I went back to sleep.
Yeah. I get that. You get the stomach drop feeling when you feel like there's something wrong in the middle of the night. Yeah.
But it is impairing then too, right? If you're not getting that sleep, you're not thinking rationally. And so what are some of those things did you come across in terms of just the impairment when you're not getting the sleep you need?
Yeah. So, like, I can speak to my own personal experience as well, because, I don't know if it was very obvious.
You're in it. Yeah.
Yeah. If it was very obvious for my manuscript, but it was a lot of me search that I was doing. Because after my first son was born, I actually went through about 2 years and a half of, like, pretty severe insomnia myself. So he was sleeping in the night, and I, just started to have those thoughts, like, what if I don't fall asleep tonight? How am I going to care for him in the morning? And those thoughts, they just skyrocketed my anxiety. And then, you're hyper aroused in the middle of the night. There's no way you're falling asleep when you're that anxious. And then you try to kind of cope with that in certain ways in the daytime that actually end up sort of solidifying or worsening the insomnia. And that's actually, like, it's a pretty good way to describe how this would form in a new mom. It's called the 3P model. So there are predisposing factors for being at risk for insomnia. And, being a woman is one. Women get insomnia a lot more than men, being of childbearing age, and having a history of anxiety or depression is a big one as well. So these things put you at a higher risk. And then you would have generally, like, a precipitating event, or something might be a big event the next day that keeps you up all night long, or something that just kind of throws off your sleep schedule. But then what really makes things problematic is how you respond to that. So those are perpetuating factors, or the coping strategies that you would take in the day that seem like common sense. Like, okay, I didn't sleep at all last night. I'm going to take a really long nap in the afternoon. Or I'm going to go to bed at 7 p.m. Or I'm going to chug back 5 cups of coffee, right? You do what you can to survive in the moment, which is fair. But these things end up worsening your sleep, and therefore worsening your anxiety. Then you kind of fall into this, insomnia spiral. So it really is about the way that you respond to that initial sleep loss, and the way that you manage the thoughts about it. Yeah. So
we'll get into that in maybe just a second. But yeah, I know from my experience too. I mean, my girls are older now, and I don't remember a lot, but I do remember being terrified as the night came. My anxiety increased so much, and I was scared of the nighttime. And I think it was just everything, right? How well is she going to sleep? Even though she slept well those first couple of weeks, she was not a good sleeper at all. So anxiety about how much sleep am I going to get? How am I going to function tomorrow? And I was still doing my master's at the time. I think I was.
Yep.
Yeah, I was in school. So then, I still need to function, and I was doing practicum, and so that anxiety, and it just spirals. And yeah, it's this snowball where.
Yeah.
you're just
builds
not
and
getting
builds
any
and builds.
sleep at
Yeah.
all.
Mm-hmm.
So what, oh, sorry. What were you going to
No,
say?
I was just going to say that you had asked about the impairment and
Oh,
like
yeah.
what the actual sleep loss does to you. And the biggest thing, or why I targeted perinatal insomnia specifically, because this, how it develops is kind of true of any type of insomnia. But there are like significant consequences of a mother who's not sleeping, right? To not just her, but to her child. So having kind of chronic perinatal insomnia, or insomnia at any time, really can lead to depression, can really increase anxiety. And with postpartum depression specifically, as you know very well, there's difficulty giving the child what they need.
Yeah.
Right.
Patching. Creating those bonds. Yeah.
Yeah. So there are quite significant impacts in that way. And on the, lesser side of the scale, there's just your mood suffers. You feel like crap. It's you get really irritable, might start snapping at people that you normally wouldn't. Like it's really, you could just kind of lose yourself without sleep. And it's so important, and it's not talked about enough.
Mm-hmm. Yeah.
Other than those, haha, get all the sleep you can now kind of platitudes that don't actually get to the heart of the issue. So,
yeah. And that relationship, mother-child bond is so important, but then the relationship with others too. If you've got other children or with your spouse or family, and you start cutting off those connections, and it can be challenging all the way around.
Yeah.
So what are some of the things that maybe new moms should be doing instead?
Yeah. So maybe I'll just give a little bit of a crash course on CBT-I, because that is, first of all, what my manuscript was about, is using CBT-I to help perinatal moms in specifically a preventative way, but not necessarily just preventative. Like if you are struggling with sleep at any point in time, CBT-I, or cognitive behavioral therapy for insomnia, is very effective for treating insomnia. It's actually considered the, first line treatment. It's not often used that way. More often it's, here, take this sleep medication. But it's very effective. Like 70 to 80% of people with insomnia that do CBT-I, either with a provider or self-guided, do see improvements in their sleep. So I think, most people are maybe familiar, or maybe it's just me thinking that people are familiar with CBT, but
are you familiar, Andrew?
No, this is the first time I've heard the term.
Okay. So there you go.
Okay. I shouldn't assume. Yeah. So that is cognitive behavioral therapy. So for insomnia specifically, we look at, the third P of that 3P model. So perpetuating factors, and that's the anxious thoughts that you have. So the cognitive part of CBT-I that contribute to worsening anxiety and more difficulty sleeping. But it also looks at the behavioral side of things. So things that you're doing that are actually throwing off your sleep cycle. So it targets both sides, the cognitive and the behavioral, to kind of reset your sleep cycle. So like, I'll give you maybe an example that may or may not be based off me. But like, say you have a new mom who has anxiety, and she starts to kind of focus in on the lack of sleep that she's getting after she has baby, starts to ruminate on that. And that increases her anxiety. So then in a day, she's trying to cope using all those strategies we talked about, taking a really long nap or going to bed increasingly early every night, which seems like common sense. But at the end of the day, what that's going to do is throw off her sleep cycle further, and is going to increase her anxiety again. There you go down that rabbit hole, right? So CBT, the cognitive side of things, is going to, again, look at those anxious thoughts. It's going to provide a lot of psychoeducation on the sleep cycle. And I think that part is especially important and often overlooked, because when we don't understand sleep, it's kind of a scary thing, right? It can seem really, really daunting. And we often try to force ourselves to sleep or to control our sleep, and you can't.
Yeah.
right? Sleep cannot be controlled, but it can be understood. And there's power in that. So the psychoeducation piece would really go into busting myths about sleep. So like things that contribute to heightened anxiety around sleep loss are, oh, I need to sleep 8 hours tonight, or I'm not going to be able to function tomorrow. That's not true. A lot of studies show people only need 5, 6, 7 hours of sleep to function okay. It may also, teach you about the function of body temperature in your circadian rhythm. So learning about that, you might learn I can take a bath a few hours before bed, so it raises my body temperature. And as my body temperature falls, that's going to increase my drive to sleep. So it really, arms you with a greater understanding of how things work. So it's not so scary and overwhelming and confusing. Like, why can't I sleep?
Mm-hmm.
And then you're going to practice changing those anxious thoughts around sleep too. So there is a lot of cognitive restructuring. There's a lot of journaling involved in actual CBT-I if you were to go to a provider. And behavioral parts of it to come in, and they address those habits that you might get into that are actually not helping in the long run. So one big one with CBT-I is stimulus control.
Mm-hmm.
So what that is, and if you've ever had a night of poor sleep, you probably can identify with this, but you're tossing and turning in bed and you're getting increasingly anxious, trying to get yourself to fall asleep. That is creating an association in your mind between your bed and anxiety. And that can become really strong. And I don't know if this is the case for you, but leading up to bedtime, when that anxiety was kind of spiking for you, that may have had something to do with it. Yeah. So what stimulus control suggests is if you're unable to fall asleep, if you're tossing and turning for 20, 30 minutes, you want to get out of bed and go and do something calming, relaxing until you start to feel tired again, and then head back to bed. So that aims to really reestablish the connection between your bed and being sleepy or sleeping to reduce that anxiety. So that's kind of like the crash course in CBT-I, but I don't know, do you guys have any questions about it or what it might involve?
No, I mean, it seems pretty straightforward when you identify it, right? Like, do something different to break the cycle. I guess, what would be some things that, like, I always look at it from the perspective of you, especially Caroline, you'll default to doing something productive, right? And that
and then I'm awake. I'm like, it's 3. Well, yeah, I'm awake.
Got a second win, third win, whatever. So that's obviously not the right choice.
Anything after 3, before 3 o'clock, I will try to go back to sleep.
Which is crazy.
After 3, though, yeah.
So what you're hearing is that her sleep pattern has never improved past the whole anxious having a baby stage. So is that things like, obviously no screen time, no TV, nothing that's going to try and throw any of that off, but is it just simply reading, meditating? Like what would be some practical ideas in the middle of the night that's not going to wake up the rest of the house too?
It really depends on the individual. And sometimes doing something productive, or it depends as well on what's keeping you up. Sometimes people have a really long to-do list. They're thinking about this one thing that they have to get done tomorrow, and it's really keeping them awake. In that case, go do that thing.
Yeah.
Go do that thing and then go back to bed when you're starting to feel sleepy again. I wouldn't get up and do like a full workout at 3 a.m. or anything like that, but go empty the dishwasher. If that's on your mind, go do, little things. That's okay. But yes, you are right, Andrew, that you want to avoid screens. Don't pop a movie on. Don't scroll through your phone in the middle of the night. That would be kind of the one guideline. And then there's things like read a book, read a really boring book.
I
do. Yeah. A really boring book. I've had clients that will crochet in the middle of the night, or knit, really repetitive things that just kind of help to shut your brain back down.
And probably keeping the lights dimmer, keeping yourself cool, not getting too hot. Because I know sometimes, and kids too, actually, that's a good hack. Just don't. I've seen babies overdressed. Like I remember one family, they're like, he's not sleeping. I think the kid was about 2. And I happened to ask what they dressed him in because we were going through like bedtime routine. Everything sounded good, but they had his onesie and then a sleeper, like a onesie sleeper, and then another like body bag and then blankets on top of him. I'm like, that's why he's not sleeping. He's so hot because the body's got to cool down, or the baths right before bed. I'll have a bath right before bed and relax. But now, just like you said, we've raised our body temperature. Our body needs to start cooling down at bedtime, right? So I remember seeing a naturopath who said having a warm cup of almond milk, because there's, what's the thing in turkey that makes you sleepy?
Tryptophan or whatever.
Yeah. I guess there's that in almonds. And so having some chewing almonds is a problem because then it's crunchy and it's alerting and it'll wake up your brain. But if you had some almond milk, warm almond milk, that'll help.
Doesn't normal milk do the same thing though? Doesn't it have the same effect? That's where it comes from, right?
Maybe.
Glass of warm milk before bed.
Maybe, but almond milk is better for you. Than our body can't digest cow's milk as well.
We are really going down a path here that I don't think we're qualified to.
He loves his cow's milk.
Yeah.
Anyway, one thing that and I know I've talked about this too, just making the brain associations, is the ABC game, where, and it has helped me. It's the only thing that's ever helped me, is just picking a category, and then you go through the category, like fruit, apples, bananas, cantaloupe, right? And you just go through to Z. And that actually, it's just pairing the brain. Okay, ABC game, time to go to sleep.
What would be
D?
A D, dragon fruit.
Yeah, that's way too easy.
That was really fast.
That was really fast.
Ready to go.
Really fast.
I've done it a lot. I've done the game a lot.
Elderberries for E?
Sure. Good for you.
I'm good at this.
That is a good one.
There's some, like, and then if you get to X and you're like, I have no idea, just like 3 seconds
bananas.
And you just go on.
I would literally think of a word. So from the outside looking in, so as someone that does not struggle with insomnia ever in my life, well, that's not necessarily true, but I don't have as many sleep issues as Caroline does, for sure. Is there anything a partner should or can do to try and help? Like, I want to be careful, right? Because nagging isn't going to help, right? Like, oh, you're going to get some sleep. But if you're recognizing some of the signs that the insomnia is starting to have an effect outside, like on the day-to-day, what can the spouse or partner do to try and either help with recognition that there might be something more going on? Because everybody's going to know, like, I'm not sleeping well, but they might not be recognizing what's happening in the day-to-day, right?
Yeah.
So what's a good way to approach that as the partner in this and say, hey, I've noticed whatever, or do you just simply hope that they figure it out, or what's the best approach there so you're not overstepping?
Yeah. I think you make, a really good point about the partner or people maybe not recognizing what's going on in the day for this person. Like, that they're not sleeping well. They just had a baby. That's kind of par for the course and expected, but you might miss the signs because the mom might miss the signs too.
Totally.
Right. You're not necessarily aware, like, you're not sleeping, but you're not sure why. Your mood is off in the day, but you're not sure what's going on, especially, if it does reach the point of causing some depression, you just don't feel like yourself. And it sometimes does take somebody close to you in a supportive way to come in and say, hey, I've noticed this, or there's something, I wonder if there's something going on for you. And just giving them that space, and I think that is really important for a new mom too, to be given and offered that space, because all you do all day is give yourself to to these little people. And it sometimes can feel like you don't have any space for yourself, or your own issues always take kind of a back seat. So to have somebody, I think, sit down with you and say, hey, how are you doing? Are you getting enough sleep? Are you feeling like it's affecting you? And like, how can I help you? Offering things too, I'm trying to think of what would be a helpful thing to offer, because sometimes putting that on somebody and saying, how can I help you? Especially if somebody is feeling depressed, that can feel like a lot. Now I have to decide how you're going to help me.
It's just one more thing I need to now deal with.
Yeah, exactly. So I think, like, see if you can take the baby and let them have a nap. can I get up in the nighttime with the baby and do a bottle maybe? Like there are so many ways that a partner can help. They're just not often brought up because, again, there's this kind of cultural thing in, Western world that the mom does it all. The mom does all the nighttime feedings. The mom, just kind of is expected to take on that primary caregiver role in the night. And that's not always necessary. There are ways that a partner can help out. You just need to have that conversation.
Well, and it's tricky too, because I always felt bad. We had just had this conversation this morning about how Andy was always a night owl. So he would stay up with the baby as late as possible. And then I'm an early riser. So it didn't disrupt our sleep too much once she was on bottles. But for the first one, we didn't start bottles until she was like 1. Because
Yeah.
And even I was pumping, so it was still breast milk, but I was just, I don't know.
You weren't down with it. There was a lot, you struggled a lot with the whole bottle thing, even just to let someone watch the baby while we went out for a bit. You weren't comfortable with it.
Yeah, I don't know. Even putting I must have been bonkers because I don't know. Because even a soother, I gave her a soother at what, like 3 months or 4 months, and I bawled. And I'm like, no, I can't give her a soother. And I took it away. And people are like, but she needs to self-soothe. And I'm like, yeah, she doesn't need a thing to self-soothe. But what if she sucks her thumb? She never did. But yeah, I don't know why. I was distraught, but
those postpartum hormones be crazy. I tell you.
Yeah. And but I think it's easy too, just what you were saying, for how we might miss the signs and our partner might miss the signs. I think there is just this expectation, oh, it's just hormones, or oh, it's just you're a new mom. But I think we got to really monitor and really watch how we're doing, because I think it's easy to shuffle everything off, with those excuses, but it actually being far more significant. So, I mean, that was helpful for us, just having
that worked for us. It's not gonna work
and especially once she had the bottle. It was great because once you went to bed, you took that last shift, and then I just knew anything after 3 was my shift or whatever. Anything else that you've found helpful or that you know of, just in terms of supports? I mean, I guess you have already talked about taking the baby and offering those naps. I just don't know if there's anything else that pops to mind.
Well, I think, again, just to share a little bit, and I feel like I'm peddling CBT-I really hard here, but as somebody who, with my first son, I went through this 1.5 years of insomnia, and I did a whole CBT-I program, just self-guided. And it has really helped this time around. I was joking with my husband the other day and just saying, like, wow, that 1.5 years of insomnia was a blessing in disguise. Because now I'm just I'm so much more prepared to handle the stress of not sleeping, because so much of it is actually cognitive. It's all the way you think about it. It's the catastrophizing that we do at 3 a.m. when we think, oh my God, how am I even going to function tomorrow? And part of that education that comes along with CBT-I is you will function tomorrow. There are countless studies that show that sleep deprivation up to a normal degree doesn't actually affect our functioning. What affects our functioning is our thoughts about how are we going to function, and that affects our mood. The biggest thing that you're going to experience without sleep is an impact on your mood, and you can control that to a certain degree by adjusting how you think about it. It can have a huge impact.
And I'll ask you, if there is self-talk that you found helpful for yourself. But I know one thing that I do with parents and even kids who have a hard time falling asleep is just talking about there's never a night that you have never fallen asleep. Yes. Your body just knows what to do, and we got to get out of its way. Because it's usually when we're ruminating and worrying, that's when we'll keep our body awake. But it's just, we never think about our heart beating or breathing. I mean, we do try to control our breathing, but there's automatic systems going on that we just got to get out of our body's way and just let your body do its thing. And if it wants to stay up, okay, well, I guess, body, tonight we're staying up a little later than I expected.
Exactly. Yeah. You can't see, I'm giving you a big thumbs up to that, because that's a huge part of it, is an acceptance piece. It is about getting out of your own way. And, it's about sacrificing sleep in the short term to benefit your sleep in the long term. If we fight it every night, and we think, oh my God, I need to sleep. I need to fall asleep right now because the baby just fell asleep and I know that I'm only going to get 3 hours. I need to fall asleep right now. You're not going to fall asleep. You need to say to yourself, I might not. And that's really okay. And if you can like believe that in your body, you will fall asleep, because that is you letting your body, like you said, do what it needs to do. And that is so much easier said than done. It takes a lot of practice. It took me about 1.5 years. But now I do. That is kind of what I say to myself. You're asking about, self-talk that I might do. I do. I still get that little burst of anxiety when it comes up to bedtime, like you experience too. And I'll say to myself, if I stay up, I stay up. Like I'll read a book. That's going to be okay. Like I'll make myself a tea. I'll hang out. It'll be fine. Sometimes that ends up happening, and that's okay, right? Because I survive.
Yeah.
And the neat thing about your brain is if you have one night of really poor sleep, it compensates the next night. That's another thing I'll remind myself of if I'm getting really stressed out. Okay, my brain knows what it's doing, and it's going to make sure that I get the sleep that I need. So the next night, it's going to put me into deeper sleep quicker. And that is a lot of the stuff that you'll learn in a CBT-I program or in that psychoeducation piece, is how your brain actually works. And that can be really reassuring when you're convinced that you're going to stay awake until you die. That is not going to happen to you.
Yeah. Well, and that's where our brain wants us to go, is the worst case. It's the end of the universe. I wish I had known this when I was a new mom. Like, this is just something that I've really learned the past couple of years, that acceptance. And I think it's helpful to try different things, like, rolling your eyes. Oh, here we go, brain, or insomnia, externalize it as an annoying, little thing where, Kate, I guess you're showing up tonight. Not the best night, but whatever.
Yep.
Do your best. I dare you to keep me up until 3. I just dare you. Like there's just sort of those kinds of things that we could do.
Yeah. Lighten the mood with yourself.
Yeah.
Right.
Yeah.
Exactly. Yeah.
Wonderful. Any last minute, anything that we missed or questions, Andrew, from your perspective?
No, I look forward to testing this out later on.
Okay. What are you going to test? What's one thing that's really standing out to you?
I'm just going to accept the fact that I'm either going to sleep or not, and guarantee I'll go to sleep. It'll be great.
You just sleep like at the drop of a hat. Yesterday, it was unbelievable. He was looking up something. So he falls asleep, and you can hear him starting to snore. And then I asked a question. He's like, yeah. And then like, he didn't even finish saying yeah. And he's back to snoring again. Like, it's unbelievable.
Early morning. Yeah. I was at the break early.
Yeah. It's unbelievable how he can just fall asleep. I definitely do not.
I came by it honestly. My dad was the king of that.
Yeah.
Yeah. I came by it honestly.
There's nothing like the 3 a.m. rage at your husband when you're up with the baby and he's snoring peacefully.
Yeah.
100%.
I know that.
We feel it. Don't worry. We know.
Good.
This has been great.
Yeah. Wonderful. Thank you so much. I really appreciate
no problem.
Coming on. And we can put this in the show notes too. Where can people find out more about CBT-I? CBT-I. I always forget the T.
Yeah. Well, the really nice thing about it is it's really effective in a lot of different ways. So you can do a self-guided program, and they're available online for free. There are audiobooks that you can do. If reading a full book is too much for you, pop on an audiobook while you go for a walk, and it will walk you through the program. They have been found to be just as effective as doing it with a provider. So you can also, if you would prefer the support of somebody as you go through it, you can look up CBT-I providers in your area. Just look for any therapist that should say on their profile if they're certified. You can ask your family doctor as well. Unfortunately, a lot of them aren't as aware of it as you would hope they would be. In that case, you might end up with an Ambien prescription, which, sometimes works. A lot of the time doesn't. But,
that just creates a big dependency trap. And
absolutely. Once you stop taking it, your insomnia is going to come right back. So it's a temporary fix. Just type it into Google. There is a ton out there, and it's very, very effective. And, insomnia at any point in your life can feel really isolating. But especially when you're a new mom.
Yeah.
and you're already feeling isolated. So reach out for help. You are certainly not alone. So I know I can feel that way, but it's very, very common. And 50% to 60% of perinatal women will develop insomnia at some point. So yeah, reach out for help. It's available.
Perfect. Thank you so much.
Awesome. Thanks so much.
Problem. Thank you.
All right. Good luck with nap times.
Yeah, thanks. Still going on, apparently. It's quiet.
Yeah, we did it.